Hi all, Andrew with Zang Physical Therapy, and today I'm bringing a message for people who have hip pain. Maybe they've been told that they have arthritis by a doctor or an orthopedic. Maybe they've been told that they're destined for a hip replacement, there's nothing that can be done. Well, that's not entirely true. There is more that can be done if you're willing to put in the work. So if you are willing to put in the work, then keep on listening. If you don't feel like putting in the work, then just move on. So if you're still listening right now, then I'm assuming you're somebody who wants to put in some work and hopefully wants to overcome some hip pain that you may have. So there are a couple big areas that anytime people have hip pain can be treated and result in successful outcomes for people. Number one is hip mobility. Oftentimes people who wake up in the morning, maybe 20 minutes, 30 minutes, even 60 minutes, it just feels like they have a lot of trouble getting going. And it's stiff, and it may be painful or achy. And even if you sit down later in the day for 20 minutes or an hour, they'll get the same thing that they get in the morning. Okay, that's very common. That says the hip joint is stiff and it needs to be stretched, it needs to be moved. Another area that you can tell that the hip is stiff is when you walk and you feel that your stride is getting shorter because your legs just don't spread apart as you take a step quite as easily as it once did. Anytime that I hear people report these symptoms, getting on that hip, stretching that hip out, loosening it up, makes a world of difference for how somebody feels. Now, it isn't going to be one session of stretching and then they're going to feel miraculously better. It just doesn't work that way. It's going to take time, it's going to take effort, stretching with a therapist and also on your own. If you're not willing to put in the work on your own, there's not going to be carryover, and the good effects that you get from being stretched and worked over by someone like me, a therapist, they just aren't going to last. All right. The second big issue is strength. Very frequently people have weak glutes, your butt muscles. You may not realize it, and it just kind of sneaks up on you. Before you know it, these muscles just aren't strong. They're some of the biggest, strongest, most powerful muscles in the body, and we sit on them all day, and we crush them, and we make them weak. So we need to get off our butts, and we need to get moving, and we need to strengthen them. So one of the simplest things that I have people do is just if they're staying in line at the grocery store, stay in line waiting for a restaurant, washing dishes or anything like that, just squeeze those butt cheeks as hard as you can for as long as you can, and then let them relax. Do it a couple times. You'll be amazed. Those butt muscles will actually get a little bit sore and a little bit tired. That's normal. That's okay. We need it. These muscles need to be worked till they're sore and fatigued. And you may even be aware of it the next day. And I tell people that is quite all right. That is the only way that strength is going to change and that meaningful improvements in function and mobility are going to happen. Okay, I think those are the two most important tips. There are certainly other ones, but we can start with those. So if you do have questions, you are somebody dealing with hip pain, you're tired of dealing with it, you want to walk more, you want to hike, you want to play golf, tennis, you name the activity that you're not doing as successfully because you feel your hip is slowing you down, then we need to have a conversation and we need to talk about what can be done. Because surgery shouldn't necessarily be your first thought in your mind. You should exhaust all other options, and that doesn't mean necessarily taking pain pills. It doesn't necessarily mean taking a needle to relieve the pain. Those may mask what's going on, but they don't treat the problem, and that problem is going to come back. So you need somebody like myself or a therapist to get in there to stretch you, teach you how to stretch yourself, to help you strengthen, teach you how to strengthen on your own, because that's the way that we're going to help you to achieve your goals ultimately. So again, if you are somebody who's dealing with hip pain, who wants to live with less hip pain, please give me a call, please email me, and we will figure out a way to get you moving in the right direction. So you can call me at 717-440-6197, or you can email me at andrew@zangpt.com. I'll be happy to continue this conversation and help you to achieve the goals that you want to achieve. Have a nice day.